training people isn't the same as educating people.
The Manitoba Association of Healthcare Professionals is raising some alarming concerns, citing that some emergency departments and care centers across the province are lacking urgent cardiac testing due to a lack of cardiology technologists. The COVID-19 pandemic has exposed many issues within the healthcare system. Staffing shortages has been a major one. Now, a shortage of cardiology technologists in hospitals across the province shows how vulnerable the system is.
People are being brought in that are not qualified to do our jobs.
COLLEEN BEMISTER is a retired cardiology technologist. She worked in Winnipeg for 28 years. She says understaffing is not a new issue, noting that the profession suffers from low enrollment rates.
The cost is very prohibitive. It's very high cost for what they're paid for once they get out. So we haven't had a raise in several years, I think, like most other healthcare professionals.
Urgent EKGs are typically performed by technicians who have completed a 56-week diploma program, passed a national exam, and are certified by the Canadian Society of Cardiology Technologists. Manitoba Association of Healthcare Professionals President Bob Moreau says with the lack of staffing, hospitals are putting people from other areas like X-ray and are giving them minimal training to run these tests.
There's risk of an incorrect test. There's increased risk for having to do the test over again, all of which adds time to the issue when time and minutes matter.
An urgent EKG should be performed by a registered cardiology technician within 10 minutes of the patient walking into emergency, which is the global standard. But Moreau says that standard is consistently not being met.
We need to get this into the care team's hands as soon as possible, and we're not accomplishing that. That's the most devastating thing you can encounter as a healthcare professional, is not being able to fulfill what it is that we need to do.
The MAHCP is calling on Shared Health to staff emergency departments appropriately so urgent EKGs can be performed. A spokesperson from Shared Health tells City News that all hospital staff who perform these are properly trained and have completed all their requirements to do so. They are currently working to address these staffing shortages. But Bemister says the entire situation is concerning, to say the least.
Heart attacks don't present Monday to Friday from 9 to 5. They happen all the time, anytime. So if they're staffing night shifts with people that are not qualified, it can be a safety risk.
In Winnipeg, Alex Karpa, City News.
Next on